Hi everybody, it's Lisa here from Holistic Health by Lisa Moan. Thank you for joining me on my regular 7:30 Monday night Facebook Live. And tonight I'm going to be talking about hair tissue mineral analysis. So it's a bit of a mouthful, but it's a test that I use a lot for children with autism and ADHD, as well as other behavioural issues like anxiety, for instance. So I'll get on to that in a moment, and if you have any questions while I'm talking, please feel free to go ahead and ask questions and I'll do my best to answer. But first of all, I'll just tell you that next week my Facebook Live is about bone health and what foods and nutrients our children need to make sure that their bones are strong, because I think we all know kids who have broken bones doing soccer, gymnastics, horse riding. And we really want to make sure that they're getting all the nutrients after that to make sure they don't break them again and that heals well. And there's so much more to it than just have milk for calcium. So join me next week, I'll be talking about that. Then a great workshop that I've got coming up in about 10 days time is a workshop about nutritional therapy for autism. So it's a beginner's guide to that and an introduction to the world of possibilities that nutritional therapy can offer for autism. So that's a real life workshop at my clinic here in Bulli on a Thursday night at 7 p.m. So if you have a child with autism or you know someone who has a child with autism in the Illawarra area, please ask them to go onto my Facebook page and look under events and sign up for that real life workshop about autism and nutritional therapy. That would be great. And so we'll get started on the hair tissue mineral analysis. And as I say, if you're watching live and you've got questions, just please pop them below and I'll do my best to answer them. So the hair tissue mineral analysis is a test that I do an awful lot. It's really easy. You just cut a little bit of your child's hair from the nape of the neck. So it's the inch or two that's closest to the nape of your neck. So if your child has really long hair, then I need to cut the long hair and just take the couple of inches that's nearest to the scalp and then discard the rest of the hair. And then I just take about 0.5 gram, put it in this envelope, and I send it away to get analysed. And it's a common method that's used for drug testing and things like that, because when you analyse the hair, it doesn't tell you what's happened in the last few days. It tells you what's happened in the last between 1 and 3 months. So for instance, if you go for a blood test for zinc and you've had a bucket of oysters the day before, then you're going to show really high zinc, and that can be misleading. So with hair, the advantage is that it's over the 3-month period. So it's more of an average. It kind of smooths out any variations because of what you've eaten or what supplements you've taken. So whenever you eat food and you get the nutrients from the food, so the zinc, the iron, whatever, they will leave your body in the hair, and that's what we test. So the minerals that we eat accumulate in the hair, as do toxic elements that might be in your body, so lead, mercury, arsenic, all those sorts of things. It shows the concentrations for about the last 1 to 3 months. So basically the hair tissue mineral analysis looks at two things. It looks at the child's how the child's stores of good things are, so your calcium, your magnesium, your zinc, your iron. So it looks at if they've got adequate stores of that. And it also looks at if the child has anything toxic in their body, so the lead, the mercury, the cadmium. And the reason why that is so important is because that has a major, major impact on a child's behaviour, a child's mood, a child's health. So if your child has those heavy metals present in their body, it's going to affect their brain, and it's also going to make them more susceptible to things like candida infection, which then is really damaging to gut health, and there's a whole flow-on effect. So why would your child have an imbalance in those minerals, so the zinc, the copper, all those sorts of things? Well, the soil in Australia is unfortunately very depleted of a lot of nutrients. So even if your child is eating a tip-top diet with lots of, leafy green vegetables, they still might not be getting all the magnesium they need because the magnesium in the soil has depleted over time. It's a bit better if you go for organic fruit and vegetables, you'll get more of those minerals, but overall that's one reason why your child's minerals might be out of balance. Then we all know fussy eating is a major problem. So a child who's a very picky eater and isn't getting the meat and those sorts of things, they're going to be low in zinc, which is going to make their sense of taste less, which means they're going to want to eat less meat. It's going to lower their stomach acid, so eating meat is going to make them feel uncomfortable. So it's a whole vicious cycle. So picky eating is a major cause of mineral imbalances in children, and that has a big flow-on effect onto mood and behaviour. If your child has an underlying infection of some sort, so a virus or bacteria, that can deplete their minerals. And if a child is just under too much stress, then that is going to also deplete their minerals, so their magnesium and things like that. So if you've got any questions on that, please pop them below. Otherwise, I'll move on to the big issues that I see when I do hair tissue and mineral analysis for children. So the first one is copper dysregulation or copper overload. So in our body, we want copper and zinc to be in a nice balance. So neither is bad. It's not that zinc is good and copper is bad, but we just need them to be in balance. And with some children, the copper gets way too high and the zinc gets way too low. And there's lots of reasons for this. Some children have something called pyroluria, which means that they get rid of their zinc too quickly, which means their copper is too high, and it leads to issues like anxiety and some social issues. And then it's also having the low zinc and the high copper is also related to ADHD, learning disorders, and depression. And interestingly, if your child is following a mainly vegetarian diet, their need for zinc is actually going to be 50% more than a child who's eating regular animal protein. So if you have opted for a vegetarian diet for your child, you need to make sure they're getting not only adequate zinc, but more than adequate zinc to make up to the fact they're not eating animal protein, because we need the animal protein to properly absorb the zinc. So something to be very mindful of if you've, for health or environmental reasons, tried to cut down your child's animal protein, they will need more zinc. Another big issue that I see is too much mercury. And again, your child could be doing all the right things and eating a really healthy diet filled with fish, and that can push their mercury too high. Because the big fish that are at the top of the food chain, so the shark, the tuna, the swordfish, they accumulate mercury. So the medium fish eat the little fish and the big fish eat the medium fish, and the mercury builds up and up and up. So if your child loves tuna, or you make a lot of shark dishes because it's a cheaper type of fish, or you love swordfish, then a child's mercury could definitely get high. And mercury toxicity, the symptoms of mercury toxicity are very, very, very similar to the symptoms of autism. So that's why I would always test a child with autism for the hair tissue mineral analysis to see if they've actually got an overload of mercury in their body, which we can then treat. It's also linked to insomnia, mood swings, and things like that. The next big issue that I'm looking out for is aluminium. And with all these things, I can take a good guess based on talking to the parent for 45 minutes or an hour. And plus with the form I get them to fill in beforehand, I can have a pretty good guess about which of these is going to come up based on their lifestyle and their symptoms. But it's really nice to have the hair test to confirm it. So the next one is aluminium. And aluminium is linked to dementia in adults, so it's very much linked to Alzheimer's. But in children, it shows itself in issues like memory loss, confusion, hyperactivity, and fatigue. And with all these different metals, there's different methods to then get rid of them from the body. So it's not a one-size-fits-all approach. We have to look at what metal is overloaded, and then I tailor a treatment plan to lower that very, very, very gently in the child. So aluminium is found in medications, personal care products, in cooking utensils. So if you've got those really lightweight saucepans, they can be aluminium. Lots of restaurants still cook in aluminium saucepan. So if you get takeaway a lot or you eat out a lot, they will often use aluminium saucepans. So something to watch out for. And the next one is lead. And I've talked about lead many times in my Facebook Lives. Unfortunately, in Australia, because of mining and our obsession with fossil fuels, our children are exposed to lead in the environment quite a lot. And there's parts of Australia where that is, very well documented. And if you have a child in some parts of Australia, the family health nurses will actually check their blood lead levels regularly to make sure they're not having too much, because children will eat the dust off the floor and stuff, which is where the lead accumulates. And it can also be in your tap water. So another really good reason to get a water filter is to make sure that you're filtering out the lead. And if you've got high lead with children, symptoms can be hyperactivity, inattention, and learning difficulties. So you can see the symptoms of these metals very strongly correlate to the symptoms of things like autism and ADHD. So that's why it's a good idea to check for these before you do take any medications. And the last one I'll mention is cadmium. And unfortunately, if your child is around a smoker, so it could be a parent or it could be a grandparent or some other carer, the child could actually build up cadmium in their bloodstream. And again, this can lead to neurodevelopmental issues. So another good reason to make sure that no parent, no grandparent is smoking anywhere near your children, as well as asthma and everything else. So if all that sounds quite intriguing and you would like to do that for your own child, it's very easy. You can actually just go to my website, so Holistic Health by Lisa Moan, and go to the shop tab. And under there, you can choose a hair tissue mineral analysis and actually organise that online. And that includes the cost of the test and then the cost of the interpretation and the treatment plan, which I provide. So feel free to have a look at that and get started. It's just about time. If you ordered it in the next few days, we might just be able to squeeze it in before Christmas. But it's getting quite close to that stage now. So next week's Facebook Live is about bone health, what to do to help your child build strong and healthy bones, and it's not just milk. And next week as well, we've got on the Thursday the Autism Nutritional Therapy Workshop here at my clinic in Bulli at 7 p.m. That is $15 to attend. But then if you book in for an appointment in the 7 days afterwards, you get that $15 rebated against your appointment. And one last thing to say is that I'm actually on leave going camping with my family up the north coast from the 15th of December to the 10th of January. So if you have been hoping to book in with me this year, best to get that sorted now, because I won't have many spots available in those last few weeks. So any questions, either very quickly type them in now or post them below, or just message me if you feel more comfortable doing that, and I'll see if I can help you. And as always, I'd love to hear what you would like me to do my Facebook Lives on, because I get lots and lots of people saying that they're really enjoying them, really enjoying the sort of the short tips on a weekly basis. But it would be really great for me if you could tell me what you're interested in hearing about, and I can tailor my content accordingly. So thank you very much for listening. I hope to see you back here at 7:30 next Monday for the Bone Health Facebook Live, or even better, would love to see you at my clinic in Bulli on the 28th at 7 p.m. Thank you. Bye-bye.